Hello, everyone. Welcome to Health Professional Radio. I'm your host for today, Tabetha Moreto. Our guest today is Tan Nguyen, Honorary Fellow from Deakin University and the President of the Australian Dental and Oral Health Therapists Association. He's here to talk about his organization. Without further ado, welcome to the show, Tan. It's so nice to have you here.
Thanks, Tabitha. Thank you for the time and the energy to reach out to our association to discuss what we can offer to the general community.
My pleasure. Can you tell us something more about your background?
I certainly do. As you mentioned, I'm the current president of the Australian Dental and Oral Health Therapists Association. So we are the peak representative for oral health practitioners, includes dental therapists, dental hygienists, and oral health therapists. And we're dental practitioners who work as members of the dental team who provide high quality and cost-effective dental services to the community.
Very interesting. Where do you do it?
As an oral health therapist, I work in a number of areas. As you mentioned, I am a current research fellow at Deakin. But my primary role is working in clinical practice in the private and public sector. We provide dental services that are very preventive focused, and this includes things like dental checkups, x-rays, fillings, sometimes removal of baby teeth as required, teeth cleaning and fluoride treatment. And so my role has principally been providing cost-effective dental services to the community, and also have a teaching role at the Melbourne Dental School as well. So we've been around for over 50 years, and we've been involved in a lot of government services, particularly around school dental services, and have a greater role now in primary health care and residential aged care facilities as well.
Fantastic. Can you tell us, why is your organization relevant, especially to health professionals?
Well, first of all, for a large number of our audience will probably know that they're probably not familiar with who a dental hygienist, dental therapist, or an oral health therapist, who they are and what they do. And so I think it's quite important that health professionals have a good understanding of who else can provide dental services, not just seeing a dentist. We're trying to increase that visibility to not only the general public, but also to health professionals in general. And as you're aware, that as I mentioned, that we do provide safe practice to the community alongside dentists as a part of a dental team for over 50 years.
That's amazing. So tell us, what's going on with your organization now? What is your biggest current event, issue, or strategy now?
So at the moment, we've been notified, and we've been working with the regulatory authorities here in Australia. We've been meeting with ministers and their advisors, looking to see what kind of changes could be achieved to increase the capacity for our profession to provide more preventive focused services to the community. And this means that we can potentially, at the moment, with the proposed changes by the Dental Board of Australia, that we're looking to extend how we can improve the healthcare system by providing more preventive focused dental services and cost-effective care to those who aren't currently accessing affordable access to dental care. And that's roughly about 50% of the Australian population. So that's why we're on radio now, is to inform that the current work and proposed changes is certainly something beneficial that would hopefully have an effect on the Australian community, but also more globally as well, because we know that there's a strong interest for our profession in other countries doing training programs to train dental therapists.
That's good to know there's an organization like yours that is very passionate about oral health.
Thanks, Tabitha. I think it's an important thing, and it's something that hopefully we can start to engage the conversation more to the broader health community, that oral health is just as important and integral to general health and well-being.
That's right. Now, Tan, let me ask you something. What is the biggest misconception the public has about you or your organization that drives you nuts and it keeps you up at night?
That's a really good question. And I think it's related to the fact that many people still don't know that many of the dental services that are being provided here in Australia are provided by dental hygienists, by dental therapists and oral health therapists. A lot of the consumers that we provide care for still think we're dentists, and largely because some of those issues of care and the dental care that we provide currently remains invisible because we can't directly bill for services with a provider number like the rest of the other health professionals. So it does limit our capacity to provide dental care to the remote and underserved areas of the community and those who currently have unmet needs. And these are particularly people who don't currently have good access to care. So it's trying to get the word out there that you don't necessarily need to see a dentist to have good dental care provided to you.
Excellent. Thank you so much for clearing up those misconceptions.
Thanks, Tabetha. Thanks again for your time.
Yes, but before we go, Tan, what is your main takeaway message to all of our listeners out there? What would you like to tell them?
I would say the key thing is that, and particularly important for our audience, is that oral health is certainly an important part of general health and well-being, and that it's important to recognise that there are other health professionals who can assist you to improve the oral health of consumers and clients that we're looking to improve and serve.
Fantastic message. And lastly, for those who want to contact your organization, how can they do that?
So they can contact us on our website. So we have a website that can provide our contact details there. It's ADOHTA, so ADOHTA.net.au. They can email us or even call us to find out more about what we do in terms of the advocacy space and improving the oral health of the Australian population.
Thank you so much, Tan, for coming on the show. It was fantastic having you.
Thank you, Tabetha, once again, and have a good day.
And that was Tan Nguyen, the president of the Australian Dental and Oral Health Therapists Association, or ADOHTA. If you like this interview, transcripts and archives are available at www.hpr.fm. We're on all social media platforms, so don't forget to follow, like, and subscribe. Show us some love by subscribing to our HPR YouTube channel. We're also available for download on SoundCloud and iTunes. I'm Tabetha Moreto, and you're listening to Health Professional Radio.